Hello, and welcome to Healthcare 101. And today's topic is blood money. And who am I? I'm Dr. Adams. I'm a radiologist in Missouri. And why am I here? I want to speak with you about healthcare reform and share my insight as a physician. Healthcare reform is going to take place in the next few months. And this is a rare opportunity. We need to grab this. And the changes that take place need to be deep and they need to be meaningful. But before you can proceed, you need to understand the problems at hand. So what are these problems? It's not that our physicians or our nurses don't have proper expertise, because they do. It's not that we don't have good clinics and hospitals or state-of-the-art technology, because we do. Our problem is primarily financial, and this financial problem today is ridiculous, and yet it's still escalating, and it's unsustainable. It's bankrupting individuals, it's putting our nation in an economic crisis, and it can't go on. People say, how can America be spending twice the amount of money on health care relative to other industrialized nations and yet get poorer health outcomes, and all the while not even insuring between 30 and 40 million of its citizens? And why does healthcare cost so much? And where's all this money going? I can assure you that these massive amounts of money are not going into my pocket, and they're not coming into my clinic. I can't afford to upgrade my equipment, and I'd like to. So where's all this money going? Some people say, I don't know, and it can't be tracked. You know, it can be tracked. Let's talk about the health insurance industry. People think that they need to have health insurance, and in today's system, they do. If you don't have health insurance, you're at great financial risk. But how much is your health insurance helping you? Or is it a problem? Or is it the main problem in our health industry today? If you watched Senate hearings recently or through the spring, you might have seen individuals from the health insurance industry testifying, and if you listen to them, you'd think that the best thing since apple pie, and you'd think that they are for healthcare reform. You know what? They're not. These industries, these corporations are out there to make a profit. They are publicly traded entities. They have shareholders. They have responsibilities to those shareholders to turn a profit and make money. These are money corporations. If you look up fiduciary duty or fiduciary responsibility on the internet, you'll see a definition that says that it's a corporation's responsibility to its shareholders to act in their best interest, to turn a profit. That's why these shareholders bought those shares, to make money. And to do that even at the expense of the parent company. Those corporations are out there to make money. They say, well, we don't make massive profits. We don't have excessive administrative fees. If you get on the internet and look up the U.S. Securities and Exchange Commission, you can see these companies because they're public entities. And you can pull up their 10K forms and look up all of their finances. In fact, let's do that. First, we'll take United Health Group. This is one of the largest health insurance corporations in America. They had a pretty good year in 2007. They made over $4.6 billion that year alone. Now this is net revenue. This is revenue after expenses. And I assume some of these expenses include pretty high salaries to CEOs and bonuses. We've seen that thing recently with the financial institutions. And this is before, this 4.6 over is before, is after expenses. Let's look at WellPoint. That includes Blue Cross Blue Shield and other companies. In 2007, they made over $3.3 billion. And Aetna made over $1.8 billion. And Humana over $800 million. Just these four companies alone made almost $11 billion in that year. That's a lot of money. That's not all of them. That's just the top four. If you dig up the S&P 500 and look at the health insurance industry, you'll see several listed there. Maybe you'd recognize yours. Cigna, HealthNet, Coventry, WellCare, Amerigroup, Centene, Medical Mutual of Omaha, Molina, Sierra Health Services. These are just the top ones. You can imagine there are a lot of these industries across the nation, all making massive profits, and when you add it all up, it's a massive amount of money. And where do they get their money? They get it from your premiums, You pay those premiums for health care. You expect to get health care in return. Instead, they're skimming off the top and they're taking your money as profits to the bank. They're giving it out to shareholders and they're taking it to the bank themselves, and they're living pretty large. And they're probably going on nice vacations, and they'll probably retire early, all on your money that was supposed to go into health care. How do they do that? How do they get those profits? They get those profits by denying you health services. So you pay your premiums, they don't pay out, they make money. How do they do that? If you're sick enough, they won't write you a policy. They'd rather write a policy for somebody that's healthy, that will be paying their premiums, and they won't have to pay out. That's a medical loss. They call it a medical loss. You'd call it paying for what you need. They call it a medical loss because they're not making the profit. They do it by, if you are sick, they raise your premiums. They charge you a lot of money. They make more profit. Or if you have a pre-existing condition, they put a rider on your contract between them and you that says because you have this pre-existing condition, they won't pay for it. But that's the reason you got the health insurance. Or they will take somebody that maybe has had a policy with them for decades, and they've paid premiums for decades, a lot of money, until they reach a certain age or they develop a certain sickness, and then they drop them. And how do they do that? Real sinister ways. I've witnessed it. And that is these, and there are, you can go on and on with all these ploys that they do in order to make profit, because that's why they exist. And in doing that, they make you, the individual, less healthy, less happy, less productive. They're making profits at your expense. That's blood money. And I'm talking about an individual being worse off because of that ploy. But if you look at coast to coast, at America, nationwide, they're making America less healthy, less happy, less productive. There should be laws against this. This is wrong, this is flawed, and it will always be this way as long as there is a for-profit system like this. As long as it's for-profit, there can be individuals that will exploit it in order to get rich. It has to be a non-profit entity doing this sort of work. Now they'd come along, they'd say, no, wait a minute, Mr. Doctor, don't you charge patients when they come into your clinic? There's a big difference here. A patient would come into our clinic, they would pay X amount of dollars for services. Hopefully we give them more than they bargained for, and as a result of that interaction, they are healthier, happier, more productive as a result of that interaction. That's the way healthcare is supposed to be. Here's the difference. These guys make profits at your expense. They make profits, you're sicker. This can't go on. Can you imagine if you got all these billions of dollars, tens and tens of billions of dollars every year generated by these companies, and you put it back into your health, into your health care, America's health care? Can you imagine the benefit that could come from this? I can't wrap my brain around it. This system has to go away. The only way it'll go away is through legislative action. I've got no power to change them. You've got no power to change them. Only your legislators do. This is kind of like with the tobacco industry a few years ago. We all saw them on TV. They were testifying before the Senate. They said, I do not believe that tobacco is addictive. I do not believe that tobacco causes cancer. Ridiculous. Well, they think we're all fools. They think our senators are fools. That was dealt with to some degree. But even that had to be done through legislative action. There was no other way. There's no other way to bring down these big, powerful entities. These are behemoths. These are Goliaths. They have a lot of money, a lot of political power. The only way to bring them down is through legislative action. And it needs to happen. These companies have a lot of money. They pay lobbyists in Washington. Perhaps your legislator is a little bit afraid of them. Maybe they don't understand the problem. You need to let them know what the problem is. Tell them that, you know, I realize now what the problem is and I want you to deal with this. If you don't deal with it, I'm not going to vote for you next time. If you don't deal with it, I'm going to get out with my buddies and with picket signs and protest in front of the doors of these companies. I'm going to protest in front of your doors. There are ways to go about this that are very civil. You can contact them through the internet. You can contact them through the telephone. Don't go to your town hall meeting and yell at your senator. That's ridiculous. But do contact them through appropriate civil measures and let them know that you realize that this is probably the major problem in our health system today. And don't let these companies get away with it. It's got to go away. These companies probably won't be dissolved, but they can be changed so that they are not-for-profit entities. You say, well, gee, doesn't a corporation have a right to turn a profit? Maybe not in the healthcare industry. Don't let these guys get away with this.